A question directly coming from one of our viewers on the channel. Can I start taking testosterone at the age of 21? I have below 300 and I for sure experience symptoms such as no energy, no sex drive, I don't even want to masturbate, etc. I also don't want to be on that injection for the rest of my life because I plan to have kids. Do you know any proven alternatives other than TRT to boost my T levels, workout, sleep, and other stuff? I know all of that, but in my case, it doesn't really do much.
Amazing. So this is the question of the first subject that we spoke about. So first, I want to send a lot of compassion to this 20-year-old guy who's reaching out to you and say he has symptoms. And I want to congratulate him for keep trying to get answers. I'm sure conventional medicine is not helping him. I have so many patients like this. And he said that in his question. He's exercising. He's doing the right thing. He's trying. He's not just sitting on his couch and feeling it. And you see his symptoms, exactly what we were saying from Dr. Ramasamy. Like most of these symptoms are low energy, low libido, no motivation. That's what we see with the younger generation. So patients like this, a lot of times when they go to their primary, if they don't pay attention, a lot of times they will end up with a prescription of an SSRI because they'll tell them, you're just depressed. Here, take some Paxil, take some Zoloft, which makes everything worse. So on a patient like this is exactly what I said before. First, we need to be aware that this happens. He's not an isolated case. And unfortunately, this is only going to get worse because the new generation, we're seeing it happening at younger and younger age. And those EDCs, like I was telling you before, they have a transgenerational effect because it does affect epigenetics and affect the DNA. So now we're seeing that men are studying at a younger age, sometimes because they were exposed to some of these EDCs in the womb or pre-puberty. So the first thing for that patient is keep looking for answers. Keep improving your diet and your exercise. But I know at some point there's only so much you can do with this. Next step would be, like as far as testosterone boosters, we know so far we haven't found the holy grail of natural T boosters. There's a lot of T boosters out there that have a lot of marketing. How much do they work? So. I have to say the one I've been the most impressed with is Tonkat Ali.
Yeah.
Tonkat Ali, actually, I saw a patient the other day who was taking this, and his testosterone went from the 300 to the 600, 700. Its LH and FSH were improved. So that's kind of the mechanism. It increases your LH and FSH almost like a Clomid or HCG. So I've seen a few cases where it works, but in majority of patients that by the time they call me for testosterone, they've tried every T booster that's online, right? And there are some mixed results, but so far I haven't found the right one. By the way, I'm working with an amazing team to try to develop a testosterone booster that really will have good clinical studies behind it, because we need this. We need that. We have a lot of young men. And he's right. The key is not to hopefully not get him on testosterone short long term at such a young age. But let's say he tried different supplements and nothing has happened. This is where I would go the route of first Clomid, clomiphene citrate, and starting at low dose, usually 25 milligrams or 50 milligrams 3 times a week or 5 days a week. And then usually I start slow and I increase the dose slowly as they continue, doing more weight training and fixing their diet. And then we do follow-up labs. And we've had pretty good response on our younger patient if they have secondary hypogonadism. So if their LH and FSH is low or abnormally low in the face of low T, they will respond pretty well to Clomid or HCG. But if that patient has primary hypogonadism, which is where you have low T and a high LH or FSH, at those times, usually they won't respond to Clomid or HCG because their LH and FSH is really pretty high. So usually this denotes that there was some kind of testicular trauma or injury, or now there's even more studies showing that EDCs can affect testicular function. There is a hypothesis called the testicular dysgenesis hypothesis, which is where if the fetus male is exposed to certain EDCs, including phthalates and BPA at a certain time of development, there is a faulty development of the testicular system that increases risk of undescended testes testicular cancer, varicocele, infertility, and low T with erectile problems. The same way Dr. Shanas one showed that, there's something they call the AGD, the anogenital distance. And she was able to show that male fetuses that were exposed to certain toxins were born with a shorter AGD. And that shorter AGD translates in later life into all of those male reproductive abnormalities. Mm-hmm. So when I talk about this, it really is scary because we're seeing a generation of younger men. It's not all of them. You know, so when I talk about this, some people tell me, we still have a bunch of young men who are like, have kids, want to have sex that are alpha males. I'm like, yes, we do. But at the same time, that study showed it, and we see it in clinical practice. About 20 to 30% of younger guys are having that issue. In my practice, 47% of my patients are less than 40.
That's young.
That's amazing. So again, to answer that patient, first, diet, exercise, then you try different supplements. If none of those work, then you go to the medication way, Clomid or HCG. A lot of times we get great results with Clomid or HCG, but sometimes we've seen that. You get Clomid on a patient, their levels go up. When I do my 2 months follow-up, I'm like, wow, your testosterone doubled. How are you feeling? Doc, no results. Sometimes in Clomid, the clinical results don't always follow the increase in testosterone. I've talked to a few other doctors doing this, and they've seen the same. So now, again, let's say this patient was my patient. I tried him on Clomid. I do my 2 month follow-up. If he felt great, I'm like, great, let's keep you on this. Let's do now follow-up in 6 months. Keep doing what you're doing. But if he calls me, he's like, Doc, my testosterone is like 900 with the Clomid, but I really don't feel anything. At this point, it is worth, depending on how bad the patient's symptoms are, but it is worth doing a testosterone therapeutic trial. And in a lot of my patients that I have like this, you put them on injectable testosterone after you discuss fertility issues with them. But the majority of those patients will improve. So yes, you want testosterone long-term to be your last option, but I want to let young people know it is an option. It is a viable option. To me, the most important thing, I want this 20-year-old man to be the best he can be. Those are his best years. I don't want him wallowing in despair that he's not feeling great and not be able to really self-actualize into what he could be. I had a great conversation with a patient. He started low T at 29, and he was a very successful entrepreneur. He was 42 when I spoke to him. And I told him, he's like, man, testosterone has changed my life. And I told him, let's kind of, the butterfly effect. Let's go back to when you were diagnosed with low T at 29. He had horrible symptoms. He was still working, but he told me he had no motivation. He was gaining weight. They tried him on different antidepressants. It didn't work. He went on testosterone, man, changed him. So 13 years later, I told him, look at your success. Now I told him, try to envision that you never went on testosterone. Where would you be today? And he told me, he's like, I don't know, but I wouldn't be the man I would be today. Yeah. So it is sad that we have to talk about testosterone in younger men, but I always am the optimist that looks at things, the glass half full. At least for that 20-year-old patient, I know I can get him to feel better. Yeah. Whether it's just Clomid or whether we have to go to testosterone, I want to tell this young man, keep going that route. Be the best that you can be. Don't let a hormonal imbalance keep you down.